Hello, I'm Kevin Durgee, and it is my pleasure to review the Business Analytics Department's response to COVID-19. This is an honor to speak to the leadership of Bassett Healthcare Network. Each of us were part of Bassett's response to COVID-19, and I thank you for allowing me to share examples of the analytic tools that were brought forward on behalf of the organization and the patients we serve. On March 12th, the first patient at Bassett Healthcare Network tested positive for COVID-19. The next day, Dr. Hennigan, our Chief Clinical Officer, pulled me aside in the Fieldstone conference room, leaned in, and said, "We're going to need a ClickView dashboard for COVID." The team and I didn't know what information was contained in Epic. We didn't know the difference between clinic screening tents or external evaluation areas located outside of our emergency departments. The situation had no playbook, but in 6 days, we had a working ClickView app. The kids like to say app instead of application. This app met Dr. Hennigan's needs and was quickly deployed to physician leaders and hospital leaders as they forged ahead meeting the situation. The ClickView app was only one of the tools the team stood up since March 12th. I'm proud of the work of the team, and I'm proud to be part of a leadership team that served its patients and community so well. Some of you are already familiar with ClickView and data visualization. Others may have heard about it. I'm going to show you the information needs that arose during COVID-19 and how ClickView is used to meet those needs. I'm also going to review what data visualization is and what it is not. Finally, I'm going to demonstrate some other ClickView apps outside COVID-19 and ask that you consider how data visualization and data exploration can benefit your area. I'll be speaking for a few minutes, which will include some live demonstrations. Please hold your questions to the end, and I'll be happy to answer them. The first app that you see is the Pandemic ClickView app. It leverages data we have within our 22,000 Epic Clarity tables. This is where all the granular data is stored. It is our job to take that data and transform it into information and convert that information into knowledge. The line graph in the upper half of the screen shows the cumulative number of patients that have tested positive for COVID-19. The bar graph in the lower left portion of the screen displays the county of residence for the patients, while the bar graph in the lower right portion of the screen shows the city of residence. At a glance, the user knows Bassett Healthcare Network has 263 COVID-19 patients that have tested positive. It also shows that Herkimer had the highest total number of any county in our service area. One of the benefits of using a visual data discovery tool is that I can quickly explore the comorbidities of these patients. On this slide, we can focus on the far right column and see there are more instances of hypertension versus any other comorbidity for the 263 patients that have tested positive. Using filters on the left, we can further explore comorbidities represented by county, Bassett PCP, or age group. This is a very powerful tool that doesn't require additional reports to be developed to obtain information. The next ClickView app on screen is the My Bassett Activation app. Video visits became essential for Bassett during COVID-19. Patients didn't feel safe coming to the doctor's office, and we experienced thousands of cancellations in late March through April. The only way for patients to access a video visit to see their doctor was through our patient portal, My Bassett. For years, we had a modest adoption rate. The Bassett Medical Group launched an all-out effort to get as many patients signed up with My Bassett as possible. They needed a way to gauge and track their efforts, as well as a way to identify patients with future appointments that did not have a My Bassett account. On this slide, you see a daily bar graph of My Bassett activations. Moving from left to right, you see that we average 50 to 60 activations a day. Starting March 23rd, you can see that we average 250 to 300 new activations each day. We took data, turned it into information, and we know that the Bassett Medical Group is successful in activating My Bassett accounts. Turning to identifying patients we can contact, the example on this slide displays patient medical record numbers with a pending My Bassett account and have an upcoming appointment to dermatology within 7 to 21 days from now. These patients can be contacted and asked if they'd like to take advantage of our video visit feature and see their dermatologist from the comfort and safety of their home. I've used the term data visualization. You're asking yourself, what does that mean? Basically, it's charts, graphs, and tables. You're consuming data with your eyes and making relationships between points, establishing hierarchy, and if we do our jobs effectively, knowing what you need to know at a glance. This is done by employing visual best practices. There are books and courses on this subject, and my team studies this at length. But there are a few things you can take away today. We remove all non-data pixels possible, including borders for charts, cute graphics that don't convey any information, and redundant chart headings. This is like having a sign that tells you you're looking at a sign. We take advantage of white space and take a minimalist approach. This allows information you need to stand out. We never use pie charts. I've banned them from my department, and you should too. The human eye has trouble seeing scale and relationships when there are more than a handful of data on a pie chart. We employ histograms and Pareto charts to display this type of data. I give you this brief explanation of data visualization to underscore that it goes beyond static standard reports. Outside of COVID-19, ClickView has been successfully deployed in other domains at Bassett. We have a ClickView app that hooks into the Care Advance database for patient progression on the hospital floors. We also have an app built for patient-centered medical home and several apps built for finance and billing. All of these apps are built to help the end user, the departments, and the programs I mentioned gain the knowledge from our source system to better serve our patients and effectively meet our mission. I invite you to consider, what information are you trying to get from your data, and what is it that you are trying to know? In closing, we've come a long way since March 12th. We were challenged as an organization and as a department. This also allowed us to do some of our best work. ClickView, with its data visualization and exploration capabilities, has proven to be a very powerful asset to Bassett and to all of you. The Business Analytics Department developed a great suite of analytical tools to respond to COVID-19. We have a dedicated, competent, and passionate department. We are very well prepared for the next time Dr. Hennigan or any one of you pulls me aside in the Fieldstone conference room and tells me we need a ClickView app. Thank you.